What if water in your nose could harm your brain? Let's learn about the brain-eating amoeba. What is brain-eating amoeba? Brain-eating amoeba is a tiny, single-celled organism called Naegleria fowleri that lives in warm freshwater like lakes, rivers, hot springs, and poorly maintained pools. It usually feeds on bacteria but can sometimes infect humans, causing a rare and serious brain infection called primary amoebic meningoencephalitis, PAM. How does it enter the body? The amoeba enters the body through the nose when a person swims, dives, or plays in warm fresh water contaminated with the amoeba. It can also enter the nose when using contaminated water for nasal rinsing, like with a neti pot. Once inside the nose, the amoeba travels up the olfactory nerve to the brain. Symptoms. Symptoms usually start 2 to 15 days after exposure and begin suddenly. Early symptoms include severe headache, fever, nausea and vomiting, stiff neck. As the infection progresses, symptoms worsen and may include confusion or altered mental status, seizures, hallucinations, coma. Death usually occurs within 1 to 2 weeks after symptoms begin because the amoeba destroys brain tissue and causes brain swelling. Diagnosis. Doctors diagnose the infection by testing cerebrospinal fluid, CSF, obtained by a spinal tap, lumbar puncture, to look for the amoeba under a microscope. Sometimes a brain biopsy is done. Specialized lab tests are needed, and diagnosis is often difficult and made late. Effect on the body. The amoeba causes inflammation and destruction of brain tissue, leading to swelling, brain damage, coma, and usually death. The infection is almost always fatal, with a death rate over 97% even with treatment. Prevention. To reduce the risk of infection, avoid swimming or diving in warm fresh water during hot months, especially in lakes, rivers, and hot springs. Use only sterile, distilled, or boiled water for nasal rinsing or neti pots. Avoid putting your head underwater or forcefully inhaling water through the nose in freshwater bodies. Maintain swimming pools and hot tubs properly to prevent amoeba growth. Treatment. Treatment is very difficult and often unsuccessful. The main drug used is amphotericin B, sometimes combined with other medications like rifampin, fluconazole, and miltefosine. Early diagnosis and treatment, along with cooling the body to reduce brain swelling, have helped a few patients survive. Do not consume any medicines without doctor advice. Brain-eating amoeba infection is a rare but deadly disease caused by Naegleria fowleri entering the brain through the nose from warm fresh water. It causes severe brain inflammation with high fatality. Prevention by avoiding risky water exposure and using safe water for nasal cleaning is critical. Early medical attention is essential if symptoms appear after freshwater exposure. If you found this video informative and useful, please like it and share it with your friends and family to help spread awareness. Don't forget to subscribe to our channel for more easy-to-understand health updates and tips to keep you and your loved ones safe and healthy. Thank you for watching.